All right, keeping you health aware. June is Brain Health Awareness Month. Recently, LSU Health Shreveport began working on a study taking a little bit of a closer look at Parkinson's disease in certain demographics of people. We'll talk a little bit about that later. But join us today is Dr. Elizabeth Disbrow, a professor of neurology and director of Center for Brain and Health at LSU Shreveport. Hey, it's good to see you.
Thank you for
having me.
Nice to meet you.
Yeah,
nice
absolutely.
To meet you.
First of all, let's talk about Parkinson's disease and what are the symptoms. Some people may know, some people may not, but there's been a lot of attention brought to this disease through Michael J. Fox, famous actor who has it.
Correct, and has started a fantastic foundation that's funding a lot of the work that we're doing in the area. So Parkinson's disease is a neurodegenerative disorder, meaning the cells of the brain are dying, and as it progresses, what we see is motor disturbance, so tremor, rigidity or cramping, I think it almost feels like, and slowness of movement. And it's hard to diagnose because it doesn't show up the same way in everyone. And so we're really trying to raise awareness of what the disease is and that we have a lot of ways that we can help people. So we have 2 new movement disorder specialists at LSU who specialize in this disease. And so if you have any questions about your loved one or you, it's now quite easy to get them checked out, and medication makes a huge difference, which is not always true with these age-related neurodegenerative diseases, but they can relieve the symptoms and really make a huge difference in people being able to keep their jobs and go about their normal lives.
And you have a new clinic also, right, at LSU Health Shreveport?
Yes, and so we've started with these movement disorder specialists, a new multidisciplinary clinic where we have physical therapy, we do some care navigation, so helping people navigate the system, and some other services, and we try to help people all in one visit. So if they're coming from out of town, or even if they're not, they can come in, one stop, and get all these issues taken care of.
Now tell me about this health fair you have coming up as well.
Yes, so it's pretty exciting. It's August 16th, it's a Saturday, and it's specifically for people with Parkinson's disease and their caregivers. There's going to be some talks about changing symptoms, which is an issue, how to deal with when your symptoms change, and then a lot of practical solutions. We're going to be there also talking about our research, but more information about physical therapy and different tools that caregivers can use. And it'll be on the LSU Med School campus in the education building from 10 to 1, August 16th, and there's free parking, big new parking lot in the big new building.
How many people deal with Parkinson's in this country, would you say, on a daily basis?
It's about 1% of the population, maybe 2% of folks over 65, so maybe about 1 million people, maybe 11,000 in our area.
You're finding out more, too, about how Parkinson's affects different demographics in the African-American community, and there's more studies as well to see how it affects that segment of population. What have you found out?
So we have several studies. One of them is working on getting data from African-American folks, because most of the data that we have is really from white people. So there's a global effort to include everyone in our efforts. And it turns out that the genetics of Parkinson's disease is quite different in people with African ancestry. And this is exciting because it's going to be a good window into finding a cure, because we know that the rates are different. Now we know the genetics are different. And each piece of information that we get like this puts us on the path to finding a cure. We have a new biomarker from the Michael J. Fox Foundation, and there's a lot of new drugs in the pipeline. I'm kind of giving myself chills just talking about it, because there's a lot of great stuff coming down the pipeline.
Hopefully you can find a cure someday. That's the goal, right?
Yes.
For all this. Hey, Doc, thanks so much for coming. We appreciate the time.
Thank you.
Thank you. Nice to meet you.
Nice to meet you.